Phase 2 now, the Republican repeal of the Obamacare individual mandate. From a constitutional perspective, sounds pretty good. From a practical perspective, maybe not so good. From a Democrat perspective, it's less about Obamacare and more about CHIP, the Children's Health Insurance Program.
The Department of Social Services is preparing notifications that will go out tomorrow, literally tomorrow, to families throughout the state, telling them that their children's health care may be eliminated, that they will no longer have access to the CHIP program. The anxieties and apprehension that they feel is unforgivable and unnecessary if this Congress does its job. They are going to be applying for emergency reserve funding, which they will need simply to continue meeting the basic health necessities of children who depend on them.
The American people rely on us to do our work, and yet they have completely just wasted the year in not advancing important legislative priorities that people and families rely on. You've heard some of my colleagues mention the Children's Health Insurance Program. That has enjoyed broad bipartisan support, and Congress has always worked across the aisle to find common ground to keep the Children's Health Insurance Program funded. Congress has to act quickly to reauthorize funding for the program, which expired at the end of September. Many states now are finding their funding running out, and they are in dire need of funding in order to keep the health and well-being of America's children intact. Think about that. What greater priority could we have as a country than ensuring that our children are healthy and safe?
These children have no place to go except the emergency room, which means no treatment. That means no drugs are available. That means that parents are left without any of those life-saving issues. And it can be as simple as this. You've got a child with an autoimmune disorder. They can't get a flu shot now, because our community health centers, our primary care, as you've heard before, all of that depends upon this funding, which means the entire infrastructure for doing the right thing, for saving these children's lives, is upended because we won't let both members in both chambers, bipartisan, vote on them.
Now, CHIP is a redundant program. Low-income children are already covered through Medicaid, if not Obamacare itself. CHIP is completely unnecessary. But what about the repeal of the Obamacare individual mandate? What will be the net result, good or bad? Joining me now from New York City, family care physician and Obamacare expert, Dr. Jonathan Vitale. Doctor, I kind of look at the repeal of the individual mandate as a good, bad, and the ugly situation. First, the good. That would be more freedom, more health care, more economic, more liberty for people, and probably less cost to the federal government. You would agree?
Yes. Well, first of all, thanks for having me, Graham. Absolutely. The individual mandate is first and foremost a tax, right? It's a tax on the lowest earning Americans. So 80% of Americans who pay the individual mandate make under $50,000 a year. So this is a tax on people who not only can't afford this insurance, but they don't want this insurance because it doesn't cover their needs, and they can't even use it when they get it because it's too expensive. The premiums and deductibles are too high. So we really do need to get rid of the individual mandate in order to give patients the choice that they want to purchase plans that fit their lives.
Okay, but let's back up a little bit. Let's look at the reason for a mandate. Why is there a mandate in the first place? Well, it's to spread the risk around, right? Because if you have too many old and sick people, you need to have the young and the healthy compensate. For example, Medicare and Social Security would never work if it was an opt-in program, right? Because these are nothing more than Ponzi schemes, and the way Obamacare is set up is essentially the same thing. You've got to have the mandate or the thing's going to start imploding. Wouldn't you agree?
Well, Graham, you have to look at it this way. That was the way that Obamacare was originally structured, to have all the young, healthy folks pay into it in order to pay for the health care for the older, sicker folks. And essentially that turned out not really to be true because the younger, healthier folks opted to take the penalty rather than pay into it. So it never really worked out that way that everybody was really paying into it. The other thing is the IRS cannot, is really difficult for them to actually collect this mandate from people who don't pay it. People cannot get criminal charges pressed against them if they don't pay the mandate. So it never really worked out that way, although it was originally designed that way. But we just haven't seen that actually materialize.
Okay, so as part of the bad, the way I look at this is that the actual law remains, that law has not been repealed. So the guts, the skeleton of the thing still exists, and so does the employer mandate. And that brings me to H.R. 4616. H.R. 4616, which is some sort of temporary fix. It would place a temporary moratorium on the employer mandate, also delay the Cadillac tax. Net result, here's what's going to happen, Doctor, is these individuals who used to have individual coverage either through Obamacare or through the private sector, they're going to bail on the entire system, right? And so it's going to be up to us, those who have health care plans in the private sector through our employers. They're going to be paying their health care when they eventually go to the doctor or the emergency room.
Yes. Well, Graham, keep in mind that I think it's important for all Americans to have a health care plan that is, at the very least, a catastrophic plan. Keep in mind that a lot of what the GOP is doing now is to try to make those types of plans legal. You know, Trump signed an executive order back in October, which was also co-sponsored by Senator Rand Paul, to help make these cheap health insurance plans legal, these catastrophic plans legal, help folks to purchase insurance plans over state lines, and also help so that people can join healthcare associations so that they have purchasing power. They can use that to leverage the prices. These are folks who may all have a common health condition.
Right, but doctor, the bottom line is anybody can walk into the emergency room with no insurance or into your office with no insurance, and you diagnose them with some sort of malady, and then they go to Blue Cross and they say, now cover me. That's not insurance. We all know that it's something else. I don't know exactly what it is, but the bottom line is that's going to spike the cost too.
Well, it will, but let me just clarify that. Yes, a patient can walk into any emergency room in this country and be treated whether or not they can pay for it, no questions asked. Now, it's different about going to a private doctor's office where they can turn patients away based on their coverage or lack thereof. But yes, that becomes a very expensive burden for all of us as Americans to bear. But the only solution to that is not just talking about the individual mandate. There's a lot of other things, too, that make health care a lot more expensive than it should be in this country, and that we could work towards helping with other means.
Like a clean repeal of Obamacare. I would start with there. I just think that the Republicans did not think this one through all the way, just kind of threw it in the tax bill for whatever reason, maybe to get reelected in 2018, and I think it's going to be fodder, once again, for the Democrats. I hope I'm wrong, but I don't think I am. Doctor, thank you. Coming up next, the massive, baseless blue state pushback to ending net neutrality as the Daily Ledger continues.